Adolescent health, something which has been neglected for a long, long period. Now it comes back, WHO is focusing it. What are the most important aspects of adolescent health?
Well, we've often thought that adolescent health was mostly about sexual and reproductive health. So it was about things like preventing early pregnancy, preventing risks for sexually transmitted infections, but it's much, much more than that. It's about mental health. So 75% of mental health problems begin before the age of 24. Injury is a big problem. It's the major cause of death in young people. So road traffic injury, suicide, homicide, they account for 40% of deaths in young people. But adolescence is also important because it lays a foundation for future health. So really major health risks like tobacco use, heavy alcohol use, obesity and overweight, physical inactivity, poor nutrition and diet, these all begin in the adolescent years and have a major consequence in terms of later life risks for cancer, cardiovascular disease, type 2 diabetes, and if young people become a parent, for their children in the next generation.
So, two questions. Mental health problems. Are they increasing because the structures of the families disappear sometimes? What is your opinion? Can we really compare previous times, 1950s to now?
There was a fascinating study that was done in India which looked at all the Indian states in terms of risk for youth suicide according to their economic development. This appeared in a major journal last year called The Lancet. The states that had the highest levels of education, the lowest levels of infant and maternal mortality, the best health profiles. These are the southern states in India, the Kerala, Tamil Nadu. These states had the highest rates of youth suicide in males. In the poorer states in northern India, youth suicide rates were much, much lower. So we do think that with economic development, with the process of urbanization, with growing expectations that come from longer education, we do think that rates of mental health problems are increasing.
And malnutrition, the changing society, urbanization, does this have an impact on nutrition of young adults?
Look, absolutely. So around the globe, the problems of being overweight or obese in adolescence or being underweight are still both major problems for adolescents. Where we tend to see the biggest problems with obesity and overweight are in urban settings, where young people have access to high-calorie foods and are often not exercising enough. In rural settings, where young people and their families are much poorer, we tend to see the problems of underweight being much more prominent.
Thank you. And if you are interested in more detailed information, look at Professor Patton's lecture at the National Nutrition Institute. Thank you very much.
Thank you.